everyone, I'm Dr. Taiyab Khatry. Welcome back. Today I'm going to discuss about an obs-gynae condition which is postpartum hemorrhage, commonly known as PPH. PPH is a very important clinical aspect and a medical emergency which must be treated as soon as possible. Otherwise, the patient will go into the shock and will die. So what is PPH? PPH is defined as the blood loss more than 500 cc after a normal vaginal delivery and blood loss more than 1000 cc after a cesarean section. But according to the new guidelines of American College of Gynaecology, blood loss more than 1000 cc irrespective of mode of delivery is called postpartum hemorrhage. PPH is the most common complication of mismanagement of third stage of labor. There are two types of PPH, primary PPH and secondary PPH. Primary PPH occurs within first 24 hours of delivery, but secondary PPH occurs after 24 hours of delivery till 12 weeks. So the most common cause of primary PPH as well as the overall PPH is uterine atonicity, but the retained placenta is the most common cause of secondary PPH.
So the management of PPH. So first line management, secure IV line first because the patient will be in the state of shock. Then give oxytocin because PPH is the complication of mismanagement of third stage of labor and the drug of choice for the active management of third stage of labor is oxytocin. And if there is no response to the first line management, we give bimanual compression to the uterus and use uterine tamponade with Khatry balloon catheter. If this also fails, then we go for surgery. If the patient is multigravida, means patient has children, we do hysterectomy. It is a surgical procedure in which we remove uterus completely. But if the patient is primigravida, means patient doesn't have children, then first we do B-line suture by stitching anterior and posterior wall of the uterus like you can see here in the image. If this fails, we do artery ligation. And which artery we are going to ligate? These are uterine artery, ovarian artery and the anterior division of internal iliac artery. If this also fails, then we go for hysterectomy.
This is the complete management protocol for the treatment of postpartum hemorrhage. To prevent PPH, we have to do proper active management of third stage of labor. Thank you. Follow करें, like करें and subscribe and comment if you have any queries.